Hey, what's up? Barnaby here. Another Hello Life moment that could, in some way, save your life. Because we're talking about your ticker, your heart, the pump that keeps you pumping. Dr. Jeffrey Chamberlain right here, who is a family medicine specialist. And you know, it's interesting, as science marches forward, we're learning more and more about heart disease and arterial problems. And inflammation is a buzzword these days. What is it about inflammation that would cause you problems as regards your heart and your circulation?
Yeah, this is something that we're learning a lot more about. Traditionally, up until relatively recently, we really attributed cholesterol being the major thing that causes heart attacks and blood vessels getting clogged and heart disease. But there's some sort of inflammatory response that's going on that we don't completely understand. Basically, what happens is that in our arteries, normally they're nice and smooth, or they're supposed to be nice and smooth. But if some sort of inflammatory factors take place, can cause some damage to the surface of the blood vessels, which makes it more likely for cholesterol and plaques and platelets to build up, causing plaques, causing restriction in the size of the blood vessel, which can cause a heart attack or a stroke.
So would inflammation be caused by some sort of low-grade infection? Because I always hear about, you have to floss your teeth, have good oral care, and I'm trying to think how that's related to what's happening down here. Could it be that there's a little bit of stuff that's flowing downward through the blood and causing compromise of the inside of the arterial wall?
Yeah. There's been studies that show things like that, like good dental hygiene actually can affect heart disease. Same thing even with cholesterol medications. The interesting thing is some medications like the statin medications, which lower cholesterol, affect inflammation some, and they actually reduce heart attacks better than other medications that might reduce your cholesterol the same amount. And so one that affects inflammation does better for protecting heart attacks versus a medication that doesn't reduce inflammation. And so there's a lot more research and interest going on. Well, what can we do? Can certain diets that are low inflammatory diets help us out? Having good dental hygiene, or what are some basic things that we can do to reduce the inflammation in our body to help keep us healthier? And there's still a lot of debate about this, and we're trying to figure this out. I think in the next 5 years, we're going to learn a lot more information about this.
That's cool. So it's 2011 right now because video lives on endlessly on HelloLife.net. So we want to just give you kind of a benchmark right there. But let's talk about other means or causes for inflammation. You mentioned oral health. Is there anything else?
There's dietary factors and using antioxidants and certain foods that are better for preventing inflammation. Interesting, the classic anti-inflammatory medications like the ibuprofen, the naproxens, don't help with this type of inflammation because those can actually increase the chance of having a heart attack and don't decrease it. And so there's a lot of that we really need to still learn about this.
Okay, what about that classic about the baby aspirin for people as a means of kind of just maybe lessening your chance of a heart attack?
Yeah, baby aspirin, taking an aspirin a day, has some pretty good research behind it showing that it can reduce the chance of having a heart attack. A lot of that has to do with the platelets and not having the platelets kind of stick together, causing the plaques.
Okay, so I guess in large regard, it falls upon us, the consumer, to figure out which doc is going to be appropriate for us. I mean, because with so much research out there, you've really got to kind of latch onto a bit of a wonk, don't you? I mean, somebody that's really just dedicated themselves to the latest and greatest in heart health research for the best information.
Yeah, things change, and so you really want a doctor that's paying attention. Things that were done 20 years ago aren't the same as things that are done now, and so you need a doctor who pays attention to as the science changes that are up to date with the latest science.
And quickly, how do you figure that one out? Because you could always ask the doc, are you keeping up with the latest journals? Of course I am. But is there a way to know?
It's a hard thing to tell. I guess talking to your doctor some is probably the best way, but there's no great resource of saying, hey, this doctor keeps up to date.
Right, like a rating system.
Yeah, it's hard to tell.
All righty, well, hey, you know what? It's all good information always from Dr. Jeffrey Chamberlain. And, we're all part of this Hello Life network. The fact that you're watching means that you're invited to do it as well. And that is simply to just communicate with us. Tell us your stories about what you know about heart health, about anecdotes, maybe just some interesting situations that we can all kind of start springboarding off of for really meaningful discussion. And that Hello Life network is found right here on HelloLife.net.